Hello everyone, I welcome you to this biology class, and in this class I'm going to be discussing homeostasis with you. Okay, so what is homeostasis? Homeostasis is derived from two Greek words which are homeo and stasis. Homeo and stasis. Homeo means similar. Homeo means what? Similar. While stasis is from the word static. That means standing still. Static or standing still. So what is the meaning of homeostasis? Homeostasis simply refers to the maintenance of the internal environment of an organism in response to the external environment. As you can see in the picture on the screen, you have a particular organisms that is undergoing different metabolic processes, and those metabolic processes are being regulated by different organs like the kidney, the brain, you have the skin, you have the glands, and so on. So all these different organs, they are helping to regulate the body temperature, the amount of water in the body, and then also the amount of solute in the body. So that is homeostasis. It helps to regulate the internal environment of an organism. So those internal conditions that needs to be regulated, they include the glucose level, the salt concentration, homeostatic and osmotic pressure, then the body temperature, then the concentration of different ions like sodium, potassium, hydrogen, and so on. All needs to be regulated for an organism to be able to survive in its environment. And like I said earlier, for this homeostatic process to be effective, to be done, to be carried out, you have organs in the body responsible for that. And those organs include the kidney, liver, brain, skin, and endocrine glands. So I'm going to go through each of these organ one after the other. I'm going to start with the kidney. The kidney is a bean-shaped organ and is usually two in an organism, and the major work of the kidney is to remove waste from the body. Okay, mainly nitrogenous waste are being removed by the kidney. So the kidney is usually referred to as the filter mechanism of the body. The filter organ is the one that helps to filter the blood in order to remove all those nitrogenous or poisonous substances from the body. I hope you are following. Okay, so basically, like I said, this is the external view of the kidney. You have the internal view of the kidney here. Okay, so and when you look at the internal view of the kidney, you see the various parts that help to perform different function in the kidney. The function of the kidney include osmoregulation, excretion, and secretion of hormones. When you talk about osmoregulation, what is osmoregulation? Osmoregulation simply means the maintenance or the balance between the salt and water in the body. That is what osmoregulation means. Osmoregulation helps to control by variation the quantities of water that is returned to the blood from the kidney, and that happens during selective reabsorption. I'm going to talk about that shortly. Okay, so the body endeavors to do that. How? If the osmotic pressure in the blood begins to rise, that means when the osmotic pressure of the body is on the high concentration, what will the kidney do? The kidney at that point will help to reabsorb more water into the body so that less urine is passed out through the urinary tract. On the other hand, if the osmotic pressure of the blood begins to fall, less water will be reabsorbed and more urine is produced and passed to the urinary bladder. And that is how the kidney help to regulate the amount of water in the body. And this is usually done and is controlled by ADH. ADH is antidiuretic hormone. ADH is the one that control osmoregulation. That is the reabsorption of water. The second function of the kidney here is excretion. That's the removal of the metabolic waste or nitrogenous waste in this case from the body. Okay, so that happens actually in three different processes. You have the ultrafiltration as a first process, you have selective reabsorption, and then you have hormonal secretion, or what you can also call tubular secretion. These processes, I believe, you must have been exposed to before you come to a topic like homeostasis. When you talk about ultrafiltration, that deals with when the blood is being filtered and smaller substances like glucose, like water, like mineral salts, they are removed from the body through the nephron. The nephron is the kidney, the tubule of the kidney, or the smallest unit of the kidney that help to filter blood. Okay, so and then after the ultrafiltration, the larger substances will be returned back to the body, and then there comes the other process I mentioned earlier, which is selective reabsorption. In the selective reabsorption, water, as an example, is being reabsorbed back into the body. Okay, it's being reabsorbed back into the body so that excess water will not be lost, and that depends on the amount of water, the amount of solute that is present in the body at that time. And lastly, you have the tubular secretion, where the urine become concentrated, and that is the excretory function of the kidney. Then you also have secretion of hormones. The kidney can also help to secrete hormone. Okay, so what kind of hormone does the kidney help to secrete? The kidney secretes calcitrol and also erythropoietin. These are two different types of hormone. The erythropoietin will act on bone marrow in order to increase production of the red blood cell, while on the other hand, the calcitrol will promote the absorption of calcium from food in the intestine. So those are the functions of the kidney. You can bear with me that you can bear witness with me that if these functions of the kidney, osmoregulation, excretion, secretion of hormones, are not done, then there will be total collapse of the system of the body. For example, if the amount of water is not being regulated, a person, of course, or an organism will not be able to survive, okay? Because that will lead to homeostatic problem, or will lead to metabolic problem. How about if excretion is not taking place? If those harmful nitrogenous waste are not being removed, that will also lead to a problem in the organism. And then secretion of hormones. I've told you the function of both erythropoietin and calcitrol. So these are very important functions that must be performed by every organism in order to survive, and that underscores the importance of kidney. Let's look at some diseases of the kidney. We have several diseases of the kidney, but here I'll just highlight few of them. You have nephritis, you have kidney stone, you have dialysis, you have kidney failure, you have dropsy, and you have kidney cyst. All these can constitute serious problem for an organism. Okay, so let's go through them one after the other. When you talk about nephritis, nephritis is a disease of the kidney. What does it refer to, and what does it mean? A nephritis is a disease condition in which the kidney will become inflamed. That means the kidney will become overblown, and as a result of that, as a result of bacteria infection. So when the kidney is overblown or is inflamed, it's usually because the kidney is infected. So as a result of that, you will see that the kidney will not be able to perform its function, like ultrafiltration again. Okay, as you can see the pictures on the screen of a normal kidney. Okay, and then you can see an inflamed kidney. Okay, an inflamed kidney has become affected by infection, mostly bacterial infection, and as a result of that, the kidney will not be able to perform a complete ultrafiltration. Will not be able to remove substances that the kidney should remove. So this disease could be acute or chronic, and the symptoms of the disease will include headache, fever, pain, and vomiting, and so on. And it could also include swelling of some parts of the body. Okay, so that is for nephritis. Then I move to the next one, which is a kidney stone. When we talk about kidney stone can be produced when the water intake is low and salt intake is high. That is mostly the cause of kidney stone, when there is low water intake and when the salt intake is high. And as a result of that, the small crystalline substances will be produced, and they will then block the kidney tubule, so that it will make the passage of urine to be difficult. You can see in this picture, you can see the stones here, okay, and the stones are already in the ureter. In the ureter usually is the pipe or the tube that leads from the kidney to the bladder. So as a result of this, as a result of the kidney stones, the person affected will not be able to pass out urine conveniently. Okay, I hope you are following. So that is for kidney stone. It will lead to series of crystalline substances to be built up in the kidney tubule that will make passage of urine to be difficult. So this is not like a real stone, but because of those crystalline substances, they become hard and deposited in the tubules of the kidney. Okay, so then you also have diuresis. What is diuresis? Diuresis actually is a condition of the kidney that will lead to the production of large volume of urine. Large volume of urine will be produced in a person that is affected by diuresis, and usually the person will take more water, but the more the water the person takes, the more the person urinates. The more water the person takes, the more the person urinates. So this condition is usually complicated in a person that has diabetic, okay? And usually in such people, they pass out large amount of urine, could be up to 5 to 20 liters per day, okay, depending on how much water they are taking. Usually this process could also be as a result of the failure of ADH, okay, which is the hormone that help to regulate the reabsorption of water. So excess water will then be released by the person affected. So the next one is kidney failure. In kidney failure, at times it's possible that the kidney will not be able to perform its function again. Okay, the kidney stop working completely and can no longer remove waste products from the body. In this kind of cases, could be as a result of injury. As you can see on your screen, it could be acute, which is sudden, and then it could be chronic, which is gradual. The symptoms could include dehydration, fluid overload in the body. Then you could also have hypertension, and then you could also have different types of solution like dialysis. Dialysis simply means an artificial way of removing waste products from the body. A person that has kidney failure normally should be able to use dialysis, which is an artificial kidney, to remove the waste product from the person's body. Okay, so the next one is dropsy. Dropsy usually is a condition that is caused by accumulation of large quantity of fluid in the tissues, and it will make the affected parts to be swollen. You can see from the picture here, the leg of this patient is swollen, and it's as a result of accumulation of intracellular fluid. Lastly is the kidney cyst. This is simply means an outgrowth, okay. So the kidney cysts, they are usually around patches of fluid that form or on or inside the kidney. As you can see in this picture, you can see the cyst forming inside the kidney, and also outside the kidney. So it can occur with disorder that may impair the kidney function. It will stop the normal functioning of the kidney, but more often the cysts are a type of simple kidney problem. Although if it become acute, if it become chronic, it could lead to the total collapse of the kidney, but it is different from a cancer of the kidney. Okay, so lastly, what are the remedies of kidney disease? Anybody that is affected with any of those kidney diseases that I've mentioned earlier, of course, the kidney will not be able to carry out its function. The first thing is immediate medical attention should be sought. Okay, and then drugs could be administered to such patient. For example, a person that is having dialysis could use diuretics as a drug, okay, which will help to reduce the problem of diuresis. Apart from that, patients with kidney failure could also undergo either dialysis or kidney transplant. What is the meaning of dialysis? Like I said earlier, it's an artificial machine that helps to clean the blood. It helps to clean the blood. So a person having kidney failure, kidney diseases could use dialysis. That's an artificial machine that will be used to remove the waste product from the body of the person, meaning that the dialytic machine will serve as a kidney for that particular person. And then it could be kidney transplant that the person will need. When you say kidney transplant, that means total removal of the bad kidney, and the bad kidney is being replaced by healthy kidney from a donor. That means a person that has compatibility with the recipient. We donate his or her kidney to the other patient so that the bad kidney will be replaced with healthy kidney. Okay, so this is for the kidney. In the subsequent video, I'm going to be talking about the liver, and then I'll talk about the brain and talk about hormone and so on and so forth. Thank you for joining me in this class. Make sure you subscribe to this channel, like this video, make your comments, ask your question, and I'm going to reply to those questions. Thank you very much. Also share with your friends and colleagues that might be in need of it. Thank you, and I'll see you in the next video.